You're not alone if you're feeling scared. In this medical environment, where you may only get a rushed 15 minutes with your doctor to make important decisions that could drastically affect the quality of your life and even the amount of years you have left, you might be wondering how to protect yourself from being misdiagnosed, given the wrong surgery, or even given surgery that you don't need. It's important to become an advocate for your own health and your own wellness, which starts with having the facts you need to know and learning the questions you need to ask to get the best results. You need an expert on your side. You need to mine Dr. Richard Guttler's 50 years of experience as a leading thyroidologist in his field. He is at the cutting edge of the thyroid wellness, education, and empowerment movement, and his course will help you gain the insight, information, and confidence to make sure that you get the help you need so that you can live well with your thyroid challenges. Let's listen to Dr. Richard Guttler talking about his powerful course.
This is Dr. Richard Guttler, clinical thyroidologist, retired, owner of Thyroid.com website since 1997. Did you know that having a thyroid disease is usually a lifetime problem? Whether you are hypothyroid or have nodules or cancer, you will need all the help to have a happy life without fear, worry while living with thyroid disease. Where do you get the information you need? Not from your primary care physician. They are too busy to spend time needed to address your fears, worries, and anxieties. Not from other physicians, especially the surgeon. 1/3 of thyroid cancer patients complain their physicians fail to give adequate information and support. Not the medical industrial complex. They won't help you either. Not Google. Google searches are too scientific or downright wrong and dangerous. All these are detrimental to your personal health and well-being. What about the surgeons? Studies have found surgeons underestimate the amount of pain and suffering their patients have after thyroid surgery. They use the term good cancer to paint a happy picture for the patients with cancer. This causes the patient to not prepare for all the pain and suffering that occurs having thyroid cancer. It also downplays the serious nature of a lifetime spent without a thyroid gland. The good cancer is a serious problem with long-term effects long after the surgery. How to have an even better life outcome even if you have thyroid cancer. The patients in the doctor's waiting room harbor fear and worries, as you can see in Rosemary Carson's painting showing all the gremlins at their heads as they wait in the waiting room. Also, or have fears so overwhelm you feel that your whole body has cancer, as seen in the sculpture by John Isaacs. Most thyroid diseases are chronic and require you to have a healthy attitude to deal with the changing landscape. Alfred E. Newman, character in Mad Magazine, had it right. To deal with long-term thyroid disease, you need to use his slogan, "What me worry." I have prepared a course just for you. I've included all my observations on human reactions to finding out they have thyroid disease, nodules, or cancer. 50 years as a private thyroid medical specialist has made me the ideal person to help you understand the disease and the emotional effects it can cause. I am retired now and have worked on my course to help you understand the disease and learn to live better with it. The thyroid cancer course is going to give you practical support how to get the best medical care, emotional support to help you get through beyond the diagnosis and treatment of your thyroid disease, hypothyroid, nodule, or cancer. The course outline, the first course is the introductory course, is all about the emotional and physical effects on your well-being with thyroid diseases, nodules, and cancer. The second course, hypothyroid course, because most thyroid patients end up hypothyroid, this is a good starting point. Whether you have cancer surgery, radioactive iodine for hyperthyroidism. The hyperthyroid course explains how the rapid onset symptoms and major eye involvement makes this one of the worst, with negative quality of life effects and ending in permanent hypothyroidism. Course 4, nodules and goiter. The most negative effects on your emotional health occur with the evaluation to find out if the nodule is cancer. Months may be needed to get the diagnosis. You need help to cope. Finding it is not cancer still may leave you with half or all your thyroid and lifetime of post-surgery complications and thyroid hormone therapy. The 5th course, thyroid cancer course, how to cope with thyroid cancer, how to understand the medical information so you can make the right decisions on therapy, how to take control of your thyroid disease, and how to get thyroid cancer treatment without surgery with active surveillance, ethanol ablation, and radio frequency ablation. This is a call to action. My course is for you. Act now. If you want my help, please consider my offer. The course is yours for $1,000. This includes my updates and availability to answer questions you have during your thyroid care. This is a self-help course and is not to replace seeing qualified endocrinologists and surgeons for your care.